Here we go. All right. Welcome, everybody, to Tuesday night Monarch Family Chiropractic Spinal Workshop. We're going to be talking about our immune system today, which is the system we love the most, we love talking about the most on a regular basis. But obviously, understanding that connection between the brain and the nervous system is where that immunity and immune system comes, from and gets its information from, and how we can support a healthy immune system through brain and nervous system, right? So it's the one component, but it's a component that people ask about the most, I feel like, and how they can impact it and what makes a difference. So we're going to jump right in to some information. Hang on, I just have to get to where you can see that information. Oh, okay. So when we talk about immune system, we talk about our two primary arms of the immune system. And so innate and adaptive, when we talk about the innate, this is that first line of defense. When we talk about our killer T cells and the macrophages, white blood cells, these are all things that work, off pattern recognition. You hear us use the word patterning, and that we are working through patterns of the nervous system, of all the brain and systems, in what they know, what they remember, what they're in a sense kind of programmed, or what they become trained to do through the patterns. But an innate system is really that first line of defense. So our natural killer cells are the T cells that are our immune cells, that are the first line of defense, that come up when it recognizes something foreign, right? When your immune system says, oh, that passing by is not me. That is something outside of my own DNA or my own, again, cell macrophage patterning. An adaptive, or T cell, B cell, is the ones that are producing, the antibodies. So again, a more refined response, but they're requiring an activation response in order to happen. So they lead that immune memory. So talking about things, where they come from, as far as getting an exposure to something versus being infected with something, or having an infection from something, is different. We are exposed to a lot of things. It just depends on what does that turn on in our immune system, and in the systems that either recognize that as foreign or don't recognize that as foreign, and what the body then does to respond to that. So an infection type, right, is the things we think about: bacterial, parasitic, again, like a fungal yeast, or viral. And obviously bacterial is coming from one component. It's different than something virally, something that's more of a virus, and how in which to treat, or what in which our body needs to do with that. Something viral in our system is a pattern that just our body takes in, recognizes, creates memory to, but it's not like it goes away. That, in a sense, your body has that memory of a virus, and that's what we want it to do, right? We want those cells to have a memory of something happening. That's what's building up and being produced with those T and B cells that are adaptive, that create an antibody to remember that pattern of that foreign thing, or that virus. So then it's adaptable to come back and attack it, or create antibodies when it's exposed to it again. And that's what our natural immunity does. And so, in talking about the three lines of defense, we'll get through a part of this presentation, because it's really two parts, and it's about an hour long. So we're going to tackle the systems and these lines of defenses in today's workshop. And I think there's a lot of research at the end of this workshop that we did and doctored during, COVID times, and just showing the connection and correlation between different things. So those will be questions to bring into the office, or to message, I feel like, more so Dr. Mayakin with, and we can address what questions are as they get there. But when we're talking about the lines of defense, again, talking about innate first, the skin is that, impenetrable, penetrable barrier. Oh, I can't say that word tonight. So our sweat, our skin is our biggest organ. So sweat glands are constantly secreting that enzyme and breaking down, if you will, the bad guy in that cell wall. So, let's see if I can follow what we're getting at on this slide. But basically, whatever signal is going to the brain also then can learn that signal and change. So if we're trying to destroy something, or just destroy the bad guy, that's a process that we can do through what our brain recognizes in that cell. Anything that breaks through that barrier through from the like a orifice or a cavity, right? So like your eyes, your ears, your nose, your mouth, that's all penetrable in a sense barrier. That's different. The protection is the mucous membrane, but the mucus is there to trap basically the bad guy. So we have what we call those microvilli, right? It's these microscopic little almost hairs or little fingers, they call them, that you don't even see with any kind of naked eye, but that is really what traps things, like the hairs or the lining in that membrane of our nose, of our lungs. Those kinds of things trap those, bacteria, the dust, the pollens, the things that try to enter through those mucosal membranes, and through those pathways. So a note that, Doc puts in here, that's through some of the research she's done, like vaccines or an asymptomatic carrier, it has a disease attached to it, if you will, but no symptoms because it didn't go through that first line of defense. So it didn't, if we are given a vaccine, we're not, it's not coming through that first line of defense. It's just being kind of, in a sense, bypassed, right? Because it's bypassing the skin and going into our system a different way. So that's what we kind of call that front door alarm system, is this first line of defense. You want things to be exposed that way. That's how your body knows, oh, good, bad guy, need to destroy. So in a sense, a vaccine is bypassing that system. And so you're not doing that natural defense mechanism that it would be if you were exposed to it. Immune systems and a healthy response, we talk about this all the time, but this is to touch on, especially when it comes to our youngsters, but with us as well, that things can look bad, but really is it bad? So when a body gets a cold or is having a response to something, that's a good reaction. That's the body saying, hey, there's something foreign in there that I'm exposed to, and the body's trying to rid of it. So like a fever, we don't have that one on here, but that's a great line of defense, right? Our body is turning up its internal temperature to kill off the bacteria or the virus. And that's what we needed to do. We needed to kill it off and to be kind of putting up those lines of defenses. So to have a fever is a good thing, not a bad thing. If there's something in there that we don't want, it's one of the best ways our body naturally gets rid of it and kills it off. But again, to vomit or to have something come out either end is also not a bad thing, because we want to have those are again our processes in which to rid of something out of our internal system. Again, coughing or sneezing or having phlegm, any of that stuff that we want to get, the body's trying to get out, a cough is a good thing. So in a sense, taking something that suppresses a cough, or for sometimes like a decongestant or some of those different types of or something that's more of a histamine, that is drying up and slowing down the process of what our body's trying to do to get it out. So sometimes there's moments of time where it can be uncomfortable, say, to get rest or sleep because we can't get comfortable, right? It's hard to maybe lay and not cough, or to get comfortable to get some rest. It's important to rest, but it's also important to have the symptoms that help get rid of what's hanging out in our system, and getting things to exit. So if your body's trying to rid of something, why do we want to give it something or take something that stops that symptom or stops that process? So that can be something similar, like giving Pepto-Bismol, or really giving, kids the liquid Tylenol or liquid stuff, a fever reducer or suppressor. Most of the times that's just delaying the process of the recovery and the healing, because it's slowing that body's temperature down so that virus has time to kick back up or to go more dormant into the system. So it tends to delay the healing process because it stops it, starts it, stops it, starts it, stops it, starts it. So if it can run its course, it is certainly usually the best way for our immune system to do its job. And again, we have to talk about, there's times when you have a very compromised immune system and you might need to add some different types of support there. But it may be doing, again, things more naturally that are anti-inflammatory of nature, or ways that support the system that way, versus something that's depressing the immune system to do its natural job. Second line of defense is in that innate. So again, more of the non-specific white blood cell, not that killer T cell. So this talks about the guard dog, right? I'm going to fight anyone who is not part of my circle or my surrounding. So an acute inflammation brings in different types of guard dogs. So we have like the mast cell, right? So making something, it's that initial, making something acute, inflamed, making an area hot, painful, maybe it brings in more of those those killer T cells. That's kind of creating an area that's protecting. So a lot of times, again, inflammation, we used to always say, oh, you got to do this ice process, right? Rest and ice and compress and elevate. Well, that's not the most recent research. It's showing that there's a reason our body is drawing that inflammation to the area to protect it and to allow some of the body to do the healing process. So to turn around and reduce that right away is actually slowing down the healing process. And so it talks about the different parts of our immune system to where that kind of second guard dog is again that soldier cell, that other part of the killer T cells that release the protein that make and bring that army, right? Bring that army to it. So we were just talking about fever and what a normal temperature is, that normal environment, to kill bacteria, to stop things from reproducing. Again, brings more of those soldier killer T cells to the area. So we talk about what I was just alluding to. You're sicker longer most of the time if you're taking kind of anti-fever or not allowing the body to do the process. If you're trying to reduce a fever by taking something, if the goal is to break the fever, if your body can do it naturally, that's its best line of defense to get over it quickly. Otherwise, it tends to linger on in the system and sometimes dive deeper in the system. So it creates sometimes an inflammation or an irritation to then another system. So it can go from, respiratory or sinus into respiratory, and things start to migrate deeper within the system. In that third line of defense and that adaptive line of defense, the innate then is response that's triggering that adaptive response. So again, innate immune system recognizes you. If it doesn't recognize that that's you, it's not your natural cells, the cells it knows, it attacks. So an adaptive stuff is, again, very specific, meaning like, okay, that's a cell, but it's a cell with a particular code marker on it, right? So the example we're using here is that adaptive cell is going, oh, okay, you're all these cells, but you have a red shirt on, and it's just targeting a specific type of cell to attack. And again, it's because it's learning, right? It's learning from other things that we've been exposed to or other ways in which we've responded to what's us, what versus not us. It's adapting to the environment. So it can be a little bit more of a delayed response in this, right? Third line of defense. It's not the first thing on site. And that antibiotic, protection is really what is our memory. It's our memory of our immune system, is to build up those antibodies to recognize a foreign invader. So that is our long-term protection. And that's a process that we need to have happen that way. Otherwise, it doesn't become a long-term protection. So there's some notes to that cross sensitivity and that concept here. If you've been exposed to a previous coronavirus, right, your T cells have some cross sensitivity to the SARS-CoV-2. So it's different when you're not having that natural immunity to it. Your body doesn't have that same process that we just went through, that 1, 2, 3, and as far as line of defense, and so it doesn't have that same way to recognize and to remember, and then have that built up antibody response. So like we talked about, that those killer T cells are in a kind of controlled apoptotic kind of package, if you will. So they package a viral cells in a sense, like we say, as like a garbage disposal, like for collection and removal. So there's articles here. We could talk an entire hour on this research alone and what's been done in this past couple years in the relation to how our immune system works. So we'll talk about a couple key points here, and then again, any of this research we have, we can post and send to you. And I think it's worth you doing some of your own due diligence to see if you have more, interest in where that's going in immune research in these last few years, to be digging in, and we are happy to give you sources. So again, lasting immunity found after the recovery of. So the immune systems of more than 95% of the people who recovered from COVID and COVID-19 had the durable memories of that virus up to 8 months after infection. So some of this, is just research that couldn't happen until things had been around long enough when we started doing these kind of tests. The results provide hope that people that are receiving SARS-CoV-2 vaccines will develop hopefully similar lasting immune memories after vaccination. Again, bunch of research here. What we're going to touch on is a couple sentences from this one, which is just that in some newer research, it's confirming that natural immunity to, COVID-19 is superior to a vaccinated induced immunity, even with the different variants we've seen. And what we're seeing is that when the Delta and the dominant was dominant in other countries, the risk of infections were much higher for vaccinated people than they actually were in the previously infected unvaccinated people. So again, we have to pull together when we're doing different things that people are getting exposed to, and then different variants, and then what types of processes are happening with what a vaccine actually does, and what we can make it do with something that's a different type of viral template, if you will. Another one, and again, this is all, immunologists are putting together a lot of research on the memory of the immune system, right, with different of the SARS-CoV-2 versus what we saw in previous infections and previous studies of, again, these memory B cells and memory T cells, because they're forming in response to a natural infection. So the studies are showing that these memory cells will respond by producing the antibodies to the variants at hand. This, again, talks about more of the comorbidities. And this is the huge component that, wasn't being talked about in the beginning, but what I think is obviously now in a lot of the research very obvious and clear, which is that most of any kind of deaths, it was needing to be very clear what type of people were affected. And it was really those that had a comorbidity, right? Which was somebody that was already immune compromised, already sick, already had other immune or system compromisations, like, between cardiovascular with heart, definitely respiratory, right, with how it was attacking the respiratory system. So people with blood pressure and respiratory failure or pneumonias, anything in those comorbidities, that was the high percentages of those who did get COVID that didn't survive it, because it was attacking systems that were already failing and already attacked. We talk about, vaccines and whether we feel like that's a prevention tool or not. It's really, these are very different. A traditional vaccine versus an mRNA vaccine do two different things. And this isn't a workshop on vaccines. So it's just, that's a conversation. If you have unclear understanding of that we have conversations around that and get you information about that, so that you can understand there's a difference in what you're receiving with this kind of with COVID versus any traditional vaccine, like you're thinking of, like polio and MMR and, pertussis, that, things like that a lot of the kids, we received as kids. So natural immunity is all facets of a virus. An mRNA vaccine is really just what probably has become more common language in the last, maybe year or two, of people understanding the spike protein. And so it's just presenting a small portion of the virus is this particular protein that the mRNA, or that part of the DNA, is attached to and linked to. So understanding boosters is really, the approach should always be, how do we support the health of the immune system, and who do we need to deliver that support to? Most people, that were sick with it were and didn't have the responses, didn't have these comorbidities. So a lot of hospitalization people that needed things like ventilators, or needed things because there was already a stress on the system. Many, if not all, were very overweight or obese, or again, had some or more than one of those factors up above. Not the healthy individual in most all cases. More research again on things that were more long-lived immunity from early 1900s and pandemics. Again, talking about how this isn't new information, that's just stuff we didn't talk about in mainstream before as much. But the B cells have been waiting for at least 60 years, if not 90, for the flu to come around again. That it's amazing because it's the longest memory anyone's ever demonstrated. So again, some of this is it's recognizing things from, the influenza pandemic and revealing how antibodies to a strain, have lasted a lifetime for people when they're testing for those much later in life after what they were exposed to many, many decades ago. So in touching on that, that's kind of giving a glimpse into how our immune system works and that there's these lines of defenses. And we could talk for hours on all different facets of how you dive deeper into that. And again, we touched a little bit on things that are really pertinent in our community in these last handful of years, which, for most everybody is understanding and seeing how we look at things different than we did 4 or 5 years ago, right? Pre-COVID, and that understanding what a virus is, understanding how our immune systems and how we can best support it. And so us giving you information and diving deep into that is the most important way that we feel we can support you doing the things to boost your immune system and support you in, living out at doing the most healthy things possible to support your systems thriving and functioning and being, if you will, on alert, on guard, ready for anything that's exposed to it. I'm trying to think of the saying we used to say a lot during that 2-year period when we were talking in workshops and when Zoom workshops began because people weren't meeting in offices and in face-to-face time. But the immunity for people and some of our younger population has diminished, and we're seeing different things show up in these time frames of when regular viruses that come around and what we're seeing people feel exposed to, because we had almost a 1 to 2 year period of people not hanging out together, right? Not being in community, not sharing basic germs, not being exposed to things. That does weaken an immune system. What does not weaken an immune system is community and being together. Now, does that mean, expose the most vulnerable? No, we have to be smart about that. We have to, think those kinds of things through because nobody wants to, put someone in harm's way. And yet the fear in which what was put in our world and our community wasn't to, in a sense, do what we strive to do, which is to build hope and to show that your immune system is way more powerful than you've ever been explained, than anyone's ever given it credit for, and that most of us have that ability to tolerate the exposures to these things just fine. And that's what we need to build a stronger immune system, a stronger community, a stronger family, a stronger set of generations to leave a legacy to. Those types of things don't happen when we isolate and when we separate ourselves from the things that make us who we are and make our systems the strength and the resilience that they can have. And so we would say, you can't kill the germ. So what can we do is strengthen the host. And so strengthening the host is strengthening that immune system. And the more we're exposed to things that through that first line of defense, the stronger your immune system will be, hands down. So it's, again, kind of taking control of what we can take control of. We can't control what, everything that's going to come our way, but we can do the things we can to have a, things that boost our immune system is what connects brain through nervous system to all systems, right? Immune system as well as our respiratory, our cardiovascular, all those, the endocrine system, our brain and nervous system. So getting adjustments there is research that boosts the white blood cell count. It boosts the killer T cell count with adjustments. So doing things you can that support the systems that run you, we can all control that. Getting good sleep, having good nutrition, right? We put good things in, we get good work out of our bodies. We fill it with, sugars, things that create inflammation. A poor diet, things that are processed, things that don't break down well in our body or serve our body as good fuel, that is creating a weaker system, right? So in all kinds of ways, we can support our immune system. And, those are just some of them that we touch in all the different workshops. So again, I want you to think about empowering yourself through what you can control and, being, again, there's a great purpose to be hygienic, right? If that taught us nothing, we could have better hygiene than many people do when we were talking about what doesn't spread germs and virus. That's all something hopefully we learn something good from. And just being more hygienic. At the same point, the body and germs aren't a bad thing. They are what build us to be the strength of a systems that we are. So I want to try to do, embody and impart you with taking action to support your systems, and control what we can control. To dissolve fear, we feel like, again, can't kill the germ. So let's strengthen the hosts. And that's you and me and all of our families around us. So thank you for joining us tonight. I hope this brings questions up. I hope this brings stuff that you come and ask us about. If you want any of the research, let us know. We will pass it on. And look forward to seeing you in the office and hearing your takeaways. Have an awesome night, everybody. Thanks for joining. Isn't that a good one?